and resources that we'll be discussing today on our Church Health website at churchhealth.org/FCE. We're going to continue the discussion on Facebook with the Facebook group called Memphis Clergy COVID-19 Response. And that's at facebook.com/group/clergy COVID-19. A couple of housekeeping items. We will ask that you will keep your microphones muted. If you have any questions, please use the Q&A button that is normally at the bottom of your screen. Do not use the chat button. Use the Q&A button. The next steps, you will receive supporting documents and information following today's webinar through the email address submitted upon your registration. This webinar, as I said before, is being broadcast on Facebook Live, and a shareable video can be found there after this conclusion. All right.
Okay, just to let everybody know, we are live on Facebook, and I'm going to mute myself. Thank you.
All right. So today, as I said, we have three pastors with us. Allow me to introduce the pastors that we have today with us. We have, like I said, the Reverend Dr. Jathaniel Cavitt, who is, he's currently serving as the senior pastor of Colonial Park United Methodist Church in East Memphis. He and his wife, Jennifer, have been married for over 18 years, and they have 3 daughters. Reverend Dr. Cavitt's first career was in law enforcement as a police officer in Jackson, Tennessee, and as a special agent in the United States Secret Service. He graduated with his BS from Lambeth University, now the University of Memphis, Lambeth campus. He has an MDiv from Memphis Theological Seminary, and his Doctor of Ministry is from Wesley Theological Seminary in Washington, D.C. Okay. Our second guest who will be joining us is the Reverend Dr. J. Lawrence Turner. He is the senior pastor of the Mississippi Boulevard Christian Church, where he has served since 2013. A native of Nashville, Tennessee, Dr. Turner holds degrees from Fisk University, Yale Divinity School, and Colgate Rochester Crozier Divinity School, where he earned his Doctor of Ministry in Transformative Leadership. He's married to the former Bridget Nicole Bush of Baldwin, New York. They are the excited parents of Josiah Lawrence Turner and Savannah Grace Turner. Our third guest is Bishop Linwood Dillard. He's a founding senior pastor of Citadel of Deliverance Church of God in Christ. He's the jurisdictional bishop of the Tennessee Metropolitan Jurisdiction Church of God in Christ, overseeing 40 congregations. He's the chairman of the Church of God in Christ International Summer AIM Convention with 15,000 delegates. He holds a Bachelor of Science degree in engineering from University of Tennessee, Chattanooga. Currently, he's pursuing a Master of Divinity from Pentecostal Theological Seminary. He's married to Mrs. Stephanie Dillard, and they parent 2 beautiful daughters, Faith Marie and Joy Marie, and they have a handsome son, Linwood Dillard III. We'd like to welcome you all pastors today and to this webinar series. And today's series is on funeral planning in the midst of COVID-19. And I would ask that you all would share with us your experiences that you've had of how you've had to make adjustments in the way that you plan for funerals and how that you are doing things now in these times. Don't everyone talk at first, but if we have someone that would like to go first, please unmute yourself and we'll enjoy listening. Well, why don't I do this? We'll ask that Dr. Cavitt will begin us off.
Hey, everybody. I think a few things that stick out for me particularly over the past month or so, that's changed significantly. I think I believe over the last 4 weeks, I've had a parishioner pass away every week over the past 4 weeks, and every week it's been different. Whereas at the beginning, depending on the situation, you have we had perhaps a little more physical access to family members and the one who's passed. And then as just sort of gradually, particularly here over the last couple of weeks, where we've been really challenged with our person-to-person interaction and contact. So what would normally for me happen would be that there's a lot of contact and communication that occurs leading up to most of the ones that have passed away here recently, because they've been older in age, been in certain situations of continuing care under skilled care or even under hospice care. And so there's a little bit more ongoing dialogue and conversation. And those, even that has become a lot more difficult. But in particular, when a loved one passes, I suppose one of the things that I try to do is engage with the family as quickly as possible to sort of set their mind at ease as far as a pastoral presence in figuring out their next steps, whether that be contacting the funeral home, loved ones, making the arrangements for the service, and availing myself to them that way. Oftentimes that's a very personal and in-person conversation. That hadn't been the case over the last few weeks. Those have been more along the lines of phone calls, text messages, which proved to be a little more challenging from a caring standpoint, because it's difficult because you want to be there, you want to be a physical presence, you want to hug the family, you want to be a support, not only just in a touching way, but also as a physical presence, the ministry of presence. And it's a little more challenging these days. About 10 days ago, participated in a funeral that was at a funeral home that was live streamed. And then we moved to the graveside, less than 10 people. It's just very, very, very strange. And I think that's one of the main challenges that for myself, I don't want to speak for anybody else, but for myself has been just the challenge has been getting through the lack of very personal interaction, especially in what is usually a very intimate time with the family in their grief. And so, and also presenting the challenges with arrangements, because there is something very therapeutic also about that process and beginning the process. But I know we'll get into some of that. So I'm just going to pause there and allow my colleagues here to take over.
Bishop Dillard.
Sure. Appreciate you all for pulling us together during this season and time. And I echo the sentiments of my brother in mentioning, just from a pastor's perspective, when you truly have a shepherd's heart, you love hard, if you will, and you have the greatest of concern for those who have come under your watch and your care. In particular, as it relates to the loss of members, loss of loved ones, which we all understand are very, very sensitive moments. And whether it be a member of your church or perhaps a family member of a member, for us, we've always attempted to offer ministry and comfort to our members, and again, those who may be family members of members. The bereavement ministry is just that, a ministry where we serve, whether that be by presence, whether that be by facilitating a funeral service that we call homegoing services, which play a very vital role, we believe, in the process of healing. There's opportunity for expressions of love and comfort, and persons being able to kind of go through those moments and feel the love and support of their brothers and sisters, and especially their shepherd. Many times when a family experiences a death, they call other family members, but they immediately call their pastor. If not, the pastor himself is there at the bedside as one is transitioning. And so again, you can just imagine where we are now at this point with being limited in access in these critical times and moments. Over the last couple of weeks, we've had a few deaths within the life of our church, whether it be members or family members of members. And as early as what week before last, I've been asked to minister or preach a eulogy at one of the services. And the Friday before the funeral, which was scheduled for Saturday, the funeral home made a decision just to host a graveside service and then even limit the number of persons, which we all understand what we're dealing with. And so at that point, especially if you come from a tradition where the homegoing services are a part of bringing closure, hearing the expression from other persons of just being around family and friends. So that have forced us to really become even creative, just as many of us are adjusting our worship services and how we engage with our ministerial teams and staff. We're having to adjust how we offer ministry to those, in this case, who are grieving. And so in this hour of social distancing, we have to pull on more technology and reaching out and being very, very much so intentional about our voices being heard, them experiencing our prayers, connecting as best we possibly can. As we understand, there's nothing that takes the place of physical touch and being able to physically see an individual. And so we are also exploring how we can expand beyond just, once they leave a graveside service, because they didn't have the typical closure perhaps that they were used to. So whether that be grief counseling virtually or assigning them to various leaders who are associated with the bereavement ministry. So there are just, I guess, layers to this. And none of us have been this way before. So we're all kind of feeling our way through and leaning in on the wisdom and insight of what's happening in other settings. So we appreciate you all again just for bringing us together for this conversation.
Well, good afternoon to everybody. And instead of me restating what has already been said by those who share this panel, as it relates to the difficulty of offering that ministry of presence, I think the challenge that many of us are going to have to grapple with is how do we continue to care for people's bodies and souls at a critical juncture, a new reality that death brings about in the life of a family and in our communities. And so this pandemic has brought I believe, a shifting in how churches will emerge from it. And I think it's going to give us an opportunity to really do some deep dialogue as clergy, and then as well within our congregations about what does the funeral rite look like for us going forward. Thankfully, we've only had one member transition since the March 15th date that we made the decision to suspend public worship. And that was an older member who had no family, and their friends were were aged as well. And so it was this determination that there would only be a graveside. However, we are beginning to give the opportunity to say at a later date after this crisis is resolved, we will gather to have a celebration of life or a memorial. And that causes us to rethink, to suggest that we don't have to have a casket or body before us to, one, celebrate that person's life, two, provide support and counsel to that family, but then third, to proclaim the good news even in death. And so I think that
Dr. Turner, your audio has gone out again.
And so I hope we would take this time to reevaluate what it means to navigate our members and our congregants through the episodes of death that come to our communities.
Dr. Turner, your audio went out, and so a bit of that we did not hear, and it came back in. You were talking about just reimagining how we are caring for our members and the families, and whether or not we need a casket there, and having a memorial service. So if you can repeat from there.
Yeah, and please, I was trying to work from one device that wasn't working with the sound, and the device I'm using now, is going in and out. But let me just recap that. I just think that in our tradition, the African American tradition, and the physical remains are a major part of it, going to the wake, viewing, and closing the casket. And I have found, I remember one episode in particular, one of our older members passed away, and they designed the day of their funeral to begin with the burial, and that we went to the church afterwards and had a celebration of life. And it was a much lighter experience for us to go through as a church family. So I just offer that, you know, there might be some rethinking that needs to go on with the church.
Okay. All right. Wonderful. And so we know that to some degree, whether it's one or several, since you've had the kind of a shutdown on our in-house services, we've all experienced the need for a funeral. How do you, what are some other changes that you all have set forth in the way you're facilitating the funerals, or even the other aspects around it?
Well, we are opting in this season not to do the traditional repast, which means after the burial, we typically would come back to the church and have a meal. We're finding a way, since people are social distancing, so the large gatherings are not possible anymore. So we will begin having the food delivered by a caterer or a restaurant to that home, to minimize exposure of our volunteers and members, and to still want to provide that bit of comfort, but we're no longer doing the repast at the church.
And I think that in addition to what Pastor Turner is speaking of, reimagining just the whole process of the funeral, I think may have played a major role in the grieving process for individuals, especially if that has been a culture and that's an expectation during that time, perhaps. But reimagining this is definitely essential in this hour, as he talks about the idea of repast. But even beyond that, from the time that a family member passes, after they have been committed to earth, days after that, we're considering ensuring that we are connecting with them, connecting their persons with grief counselors. We're yet expressing and showing love, because in some cases in churches, after the funeral, all the cards slow down or cease, all the phone calls stop or cease. But I think in this context, at this point, beyond the graveside service, is going to be very critical. Everyone processes death differently. Everyone deals with the grieving process differently. And so it's going to be very important that we stay connected to these individuals as best we possibly can, whether that be through FaceTime. Of course, we can call, as Dr. Turner mentioned, sending food or just cards, continually keeping up with them. How long or what that time space may be, I'm not sure. But I do believe that after the graveside service, there has to be some intentional reaches and touches and connectivity.
To piggyback, there are two things that came to mind. To piggyback Bishop Dillard's words, it's a challenge when you don't have, with a funeral, when it has a central place in the grieving process and in the healing in the wake of that. I feel like it's so difficult in this day and time, because usually even in the days and weeks after, you can get back to some sense of normalcy, a routine, or back to work or things, and we don't really have that right now. Our people don't have that, and so I think that presents some really dynamic changes and challenges for our ministry, realizing that it's going to be a little while before there's a new normal that's established in these families and in these relationships. And I would say, I can't speak for everybody on this, but I would say for me, especially over the last few weeks, as things have continually evolved socially and in our community with physical distancing, with the safer at home orders and essential services and all, is that I feel like I am collaborating a lot more with the funeral directors. Whereas with most people, most of the funeral directors on a normal funeral, we sort of know each other's roles. But for me, because I needed to know, I hate to say this, and I'm not trying to bust anybody out, but every funeral home doesn't handle the standards the same way. And so it takes a little bit more conversation, I have found, than normal, not just an immense amount, but there's a lot more back and forth with the funeral directors and in their guidance for the services as well.
Okay. Another question that we have from the participants, this comes from Pastor Earl Fisher. He's asking, has anyone seen a shift in insurance policies for parishioners due to COVID-19, knowing that different families have different policies that we may be able to share with others that provide options that aid the family financially and emotionally? Has that been something that you all have had to deal with regarding a member's insurance policy?
Is that specifically speaking to this season that we're in?
Right. Due to COVID-19, knowing that different families have different policies, has there been a shift in insurance policies for parishioners that we're able to share with others that provide options that aid the families financially and emotionally?
That's not been my experience or so.
Okay. This other question is coming from Sheila O'Mara. She's asking, how are you supporting families when they can't be with loved ones when they die in a hospital or other facilities, knowing that hospitals have put restrictions on who can be in the hospital, and even there are times where husband and wives cannot be together during that moment of transition? How are you supporting the families?
It's being a little more accessible than I typically would be. On several occasions, many occasions, I am there with that spouse or that family when it's nearing the time of the transition. But now it is you're constantly in contact. You're calling regularly. You're texting. Hey, thinking about you. Just checking in. Just to maintain that connection. So I think in just the climate the way it is, we can't visit, neither can they. And so we want to make sure they know we're thinking about them, that we're remaining in touch with them and seeing what they can say for themselves would be the best ways for us to support them during those times. Because it's hard. I'm sure it's doubly hard for the family as it's difficult for us who are so used to being by the bedside.
Okay. So you may mention of using technology, Dr. Cavitt, in regards to a funeral that was live streamed at the funeral home. Are there other ways that you're able to use technology, either in supporting the family or in any other way? And not just Dr. Cavitt, but either one of you.
And at this point in my experience thus far, of the opportunities for ministry at the time of death, a lot of the folks that I'm working with are not up and connected and wired or unwired, I guess, like we are today. So, if it were somebody who has the capability, obviously, the same type of software that we're using here, Zoom or FaceTime or some sort of video chat, Google Duo, any of those would be ideal, because it's always great to see their face and to see the expression that goes along with the words that they choose. And it's obviously no substitute for the in-person contact, but other than that, those are, in my particular instance, I haven't been able to use that because the folks that I'm working with, at least in my interactions, aren't accessible. So really the phone call is the primary source of contact or a source of touch. And so outside of that, that's been my brief experience thus far.
I would say the same for me. I was just thinking about one of our members, her father passed. And so this was just when this thing first started really picking up steam. And I called her one evening, and I could tell that she had just maybe gotten up from a nap or so. And I called and spoke with her and prayed with her. And she just began to talk about how that just made her day. I think everyone understands where we are right now. And although we all appreciate and understand the need sometimes for the personal touch, but with everyone understanding where we are, I think that call, that reach, hearing that voice, hearing those prayers, and other persons, of course, also associating will have to probably pick up more and more. But I think just that personal touching by call, and if you can't call, again, going back to those who may be able to do the FaceTime or Skype or so on their phones, kind of help walking them through that kind of thing is very, very significant.
Okay, so in the day of where we're using some advanced technology now, we can see everybody wherever they are. You're just telling us to use the good old-fashioned telephone, huh? Going back to what we've used for years and years. All right. I want to go back to Pastor Earl Fisher's questions. He is trying to clarify it. He says he's thinking about how insurance policies would typically cover services and options that are not currently available because of social distancing requirements. So have you seen ways that those policies may have shifted to offer services other than those typically available? Dr. Turner, we can't hear you right now. Now.
Okay, great. Typically, that discussion of insurance, we typically would have that earlier on. Our church has a legacy program where people can make and beneficiaries of their policies. Now, as it relates to that piece, haven't been in that discussion so much, and I'm thinking that you might be thinking about a specific burial policy that is designated as such. And I think this might be an opportunity to have a conversation with an insurance agent and that family, because if that policy is specifically for a burial, I don't know how, like a pre-need plan, I don't know how a funeral home would handle this, particularly with those scheduled to pay out for a certain kind of funeral versus if now they opt to have a cremation. So I think that conversation needs to be happening with individual funeral directors, and you probably want to talk to somebody in the insurance business to know if this is a policy that's specifically for burial purposes.
All right. On a practical standpoint, can you give an example of what you can say to a family for the planning of a funeral as an officiant? How can you help direct the family to plan a funeral with and give a practical example?
Not to always jump into the void of silence. I don't mean to cut him back. I think one of the things that, and I do this, I try to do this every time, regardless of the situation, because family members put such an immense amount in our tradition. It seems like family members put such an immense amount of pressure on themselves to have the perfect service, and they just want it to be right for their loved one. And they want them to be proud. And in so many ways, that's honorable. But I try to tell people there's no, outside of a few broad boundaries, there's no right way or wrong way. There is a faithful way, and that's all we need to worry about. And that's going to be expressed in many different ways and forms. And I think that's especially true in this time. And so, there are some times where a family wants to sit down and say, what do you normally do? And you sort of run down the service, you run down those things. But then there are times where the family is just so, maybe they're tied to a loved one's expressly written and well planned out funeral. And they're trying to adapt that for these days and times. And I have found that if as a pastoral presence, if you will simply give people permission not to put that pressure on themselves, and knowing that their loved one, even regardless of the personality, would appreciate the circumstances that you're in, and know that you're honoring and celebrating their life, and that the gospel is proclaimed in the face of death, and that you're faithful in that task as a family, you will have done well and served your family and your community well. So I always try to begin with a little bit of permission giving, so that the family can relax and truly encounter and see what the Spirit is stirring among them during that process of planning a funeral and planning all the movements around that.
And as a follow-up to this question, can you address it in light of social distancing? If a family is bent on or trying to have a traditional funeral, and another thing that I was thinking about is advanced care planning. Having a talk with your family members ahead of time, especially in light of these new rules, having a talk and to see what they would like to do. But in light of the social distancing rules and a family that is bent on trying to have a traditional family, what would you suggest?
So I would suggest, one, if you can, get out ahead of it. So be able to communicate with your congregation as a whole to say, we understand what we've done traditionally. However, because of this health crisis, this is some steps that we're taking to protect you and your health, as well to do what's meaningful for your family. And I think what's been meaningful in my tradition is not just the immediate family taking part in it. It's the church, it's the wider community, their friends, if they're part of a fraternity or sorority, you want those persons there. And that just can't happen with just the allotment of 10 people. And so I think if you get ahead of it and share with the church, we want to honor your loved one's life. We want to celebrate their contribution to our faith community. However, it is not safe at this time to expose ourselves to potential infection.
Do you all normally have a discussion with your parishioners regarding advanced funeral planning?
So for us, of course, when persons join the ministry, part of the, I guess you say, introductory classes or orientation, a part of what we offer is bereavement ministry. And so to Dr. Turner's point, I think we have to rethink how we communicate and convey to our members at this point where we are relative to all of the services and things that we offer to our constituency. One thing that came to mind that we could consider in light of a service or funeral, maybe if there could be some way we could allow expressions or encourage them to get expressions from different family members or friends, 60 seconds or so, and just send it out to their entire family, or set up something to where perhaps we could get someone to sing a solo or someone to record a scripture or a poem, and we have our team to put something together and send that file MP4 to their family, maybe 20, 30 minutes. And just as, of course, we are ministering now online and preaching, teaching, we probably could have a sermon or eulogy recorded for about 10 minutes and send to their family. So there are various ways I think we still can make that connection and give them opportunity to have some touch and feel of the church.
All right. So this question is coming from NL Transu. They're asking, are there any restrictions from the mayor's administration numerically for having a graveside ceremony?
I don't know if I could speak on behalf of the mayor, but I think that 10 people is the max, and the 6 feet rule still applies, meaning that you have to maintain 6 feet between each person. And the mayor is just restating the CDC, and that applies whether you're indoors or outdoors.
Okay. Another question is, what have you found most challenging and frustrating as you coordinate funerals and memorial celebrations while practicing social distancing? What's been the hardest thing or most frustrating?
The distance. I mean, just not being able to be your proximity. It just, for me, that's it. Is just the hardest thing for me is the physical. And I'm not necessarily a hands-on touchy-feely person, but there is the proximity and being able to be close and to hold a hand, or to have your hand on a shoulder, or exchange a hug, or some sort of supportive gesture. That for me, that's the biggest void and one of the biggest challenges when it comes to the personal aspect.
Anyone else? Okay. So with Dr. Cavitt, you talked about working with the funeral directors. Do y'all have any suggestions of how either clergy or even the family members can work even more closely with funeral directors?
Sure. I believe that they also are having to make major adjustments in how they offer their services and conduct their services. And so I would believe that they would be just as much inclined as the pastors would be in coordinating and helping that family navigate and walk through that. And so on the front end, just as we would prior to this, be engaged in the planning process, that there needs to be a conversation about the logistics and how all of this would play out throughout the entire process and how they will engage, because it also may help if the pastor and the funeral director are together, help that family come to understanding if there's any challenge of sort as they are planning out the services.
All right. Anyone else? Okay. So I'll ask this question, and this will be our last question of the day. What kind of follow-up plans do you think will be necessary 3 and 6 months down the road for those loved ones who are grieving and loss of a person during this time? And so what do you think, should be a follow-up?
I think there should be an intentional effort, not just from those of us who are pastors, clergy, but this is an opportunity to bring in those who are lay leaders in our churches to establish what I would call a continuum of care, which means from the time that moment of closure as such happens, just constant contact with those families and letting them know we're still thinking about you, we're still praying for you. Is there anything we can do? Make yourself available to them when they're ready, if they need to talk. I don't think we wait until 3-6 months down the road. I think that it's important that that connection is never broken.
Any other comments, thoughts, concerns, ideas? Well, we'd like to thank you for taking the time out and sharing with us your experiences and thoughts and how we can continue to serve our members and love them and even usher their spirits. This has been a continuing series of the Memphis Clergy COVID-19 Response webinar series with Reverend Dr. J. Lawrence Turner, Reverend Dr. Jathaniel Cavitt, and Bishop Linwood Dillard. Thank you very much for your time and your service to us. And those that are participating and watching, you can see this broadcast again on Facebook Live, and also we'll have it on our website with some resources. And we'll see you next time. Thank you very much.